At the end of the day, making sure that we understand, and as I think about it in healthcare, what are we creating? What are we buying?
Hello and welcome everyone to the next episode of the AIM Media House podcast Simulated Reality. Today we have with us Mitch Kwiatkowski. He is the Chief Data and Analytics Officer at Marshfield Clinic Health System. Mitch has worked throughout his life in the field of healthcare and at the intersection of technology and healthcare. And today we are going to talk about a very interesting subject on the need or the importance of AI governance in healthcare systems, right? Mitch, firstly, welcome. How are you today, and how is your day going?
Thank you. I appreciate you having me here, and it's going well so far. Thank you.
Great, fantastic. So, Mitch, AI governance is not a new topic. It's something that which is being talked about, especially from the context of its real life implementations on day-to-day basis, right? That can impact individuals or communities or societies on a very regular basis. And there started to be several instances that come out of it due to the lack of governance or the lack of responsible development of that technology, right? Before we start or move into AI governance into healthcare, can we kind of set the context and identify what your definition of AI governance is? What does it mean for you exactly?
Yeah, I think at its core, it's really about how do we develop and use AI responsibly and ethically. I think there's different ways you could slice and dice that, but at the end of the day, making sure that we understand, and as I think about it in healthcare, what are we creating? What are we buying? What are we using? How are we using it? And who are we using it on or for? I think those are really important things to think about. And we have to have those discussions openly and honestly in the organization. And in some cases, we may look at something and say, well, we can do this. We're a highly regulated industry. There may be some things we say, well, there's no reason we can't do this, but should we? Is this something we're comfortable doing? If we have to talk to patients about what we're doing, why we're doing it, how comfortable are we there? So again, it's just really making sure that it's responsible and ethical in how we're using it.
From what I'm getting is responsibility and ethicality are the two main aspects of AI governance, right? And now with respect to healthcare, right, what are some of the challenges that you have seen so that, so we have addressed AI governance and healthcare, and then maybe we can go into a little bit more detail. What are some of the things with regards to AI governance and its challenges with regards to ethicality and responsibility that you have seen? If you can help us with a few examples in the field of healthcare, and then we can move into a little bit more detail on the topic.
Yeah, and we've had challenges for a long time, not just within AI, but even how we use data and how we're sharing data, what we're doing with it. So there have been a number of examples over the last few years. I mean, if you look broadly in any industry, there are a lot of examples of areas where people felt that maybe there was a bit of a violation of privacy, or maybe an organization shouldn't have done something. In healthcare, we start to see things. I mean, we're dealing with some of the most personal information that we can with a person, right? So it's about their health and well-being. It's about social risk factors, mental health, etc. So, as we look at different populations and how AI gets used or how the data gets used, we've seen cases where some of the ways in which an AI model or an AI system will work can be biased against certain areas, certain races. It could be genders, and this is largely, if you look back, it's largely because of the training that's been done and maybe not using a good set of data that represents all protected classes equally. We might be using things like cost, for example, as a predictive feature that, again, if you're not looking at the data that's going into training the model, you may unintentionally invite some bias in there because you're not accounting for the fact that maybe some races and some areas of a geography, there aren't as many costs or as much expense on healthcare, but that's not because they don't need it. So we've seen commercial models out there that have been biased towards race because they use cost as a predictive feature. We've seen risk models or predictive models for conditions, pain levels, things along those lines that have not taken certain races into account. Again, race tends to be one of the bigger ones we see, but again, gender. And there have been cases where a model, and I believe it was in the UK not too long ago, there was a model to predict heart attacks, and it was something like 50% more likely to misdiagnose a heart attack for women because it didn't account for the fact that women have different symptoms of heart attacks than men do. So these are definitely, they're out there. Those are the ones that we know about. And again, going back to governance, a lot of it's about trying to proactively prevent some of these from happening as best as we can, or when they do happen, how do we react and mitigate those quickly?
Correct. So I think 3 points here, right? One is the data privacy aspect of it. One is the bias, which is there, and the overall ethicality around it, right? So let's address this one by one, right? Probably, and understand how can we do or how can we avoid some of these things. Let's start with data privacy, right? One of the things that you mentioned was that patient healthcare data is collected at a large scale. It may be insurance companies, it may be hospitals, and it's important to collect that data. The data is crucial when it comes to, not just for analysis purposes, but for an individual purposes as well, as case by case basis when a doctor kind of looks after the patient, right? Now this data is being collected and it is being used by insurance company, health insurance companies, or health tech companies, or healthcare companies, which is there. It's not a bad thing as well in its entirety, right? Being able to diagnose better or improve patient care better. But where does it exactly go wrong? And what are some of the things, or what are some of the frameworks that you have observed that need to be implemented to ensure that these data privacy issues don't happen and it does not affect an individual or a community?
Yeah, I think one of the challenges around privacy. So as I mentioned before, healthcare is highly regulated, and we've got HIPAA in place, and you can collect and use patient data for treatment, payment, operation purposes, and broadly, when organizations create their notice of privacy practices that says to a patient, "Hey, we're collecting your information, we can use it for these things, et cetera," it's very broad. It's very general. It doesn't get into the details of these use cases that are out there. What we see though is, healthcare organizations will, they'll go out and they'll get a product or service from a vendor. They share the data that they've got on patients. Sometimes vendors ask for more than they really need. In some cases, they're collecting this information and it stays isolated just for that customer. In other cases, the data gets added to their large set of data that they have for all customers, and then that can go in and that can further help train their models and so on. So these are things that, again, is that, and I think, I know of healthcare organizations that are trying to tackle this question. Are we comfortable with our patients' data? Is that allowed to be used to further train some of these commercial products and solutions that are there? And again, it goes back to how much do the patients know about what's happening? We're not required to necessarily collect consent for individual use cases. Again, when we do our notice of privacy practices in healthcare, we look at that and we say, hey, you're signing this, you approve it. We're doing this for, again, treatment, payment, operations. But those are there are times, and again, going back to where governance can play a role is it something, is the use case, is the solution something we feel that we should apply informed consent, where we go out to patients and say, here's what we want to do. Do you consent to your data being used? So I think those are pieces. And again, once that data leaves your organization and it goes into another environment, what happens to it? Do we really have good eyes on it to see? And how is that third party or fourth party? Are they making sure that they're protecting the privacy of that data as well?
So transparency is key here. Like essentially what you're trying to say is collection of data is natural. It will happen over a period of time. Usage of data is also going to happen because it has a lot of benefits, not just for the private companies, but also overall patient care. But at the same time, it's very, very crucial to communicate that this data is being used for this purpose. And that kind of solves, in a way, kind of addresses to an extent the issue of data privacy.
It does. And we have to strike a balance too, because we can't, not everything we do is going to be something we certainly want to try to be transparent, but we can't go and consent for everything, or we don't, necessarily, want to, because we have to be careful that in being transparent and explainable, making sure that people understand what it is that we're doing. We don't want people to get nervous. It's very easy for people to get excited about hearing AI and thinking, oh, I don't know where my data is going. I don't know what they're doing with it, and shutting down and saying, well, no, I don't want my data used for that. When in reality, and again, this is where governance plays a role. How do we weigh the pros and cons, the benefits and the risks that are there, and make sure that we're doing the right thing? So it is still a balance, but you're right. That's that transparency and again explainability can help.
Okay, perfect. Now, the second point that we discussed was around bias, and this bias was especially with regards to individual sections of the society. It could be based on the basis of race, it could be on the basis of gender, or it could be on the basis of communities, right? One of the things that I have observed over a period of time, right, and from whatever I've read, it's more about the data itself, like the data or the sampling of data that is collected, which is used to train the model, which kind of develops inaccuracies, right? There was this model about recidivism of individuals, right, who are more likely to go into this thing, or the facial recognition technology, which kind of failed on a certain section of the society. Now, that is something that we already know, right, as something which research has predominantly shown that is the case. But is that only the problem? What is your observation on this, especially in the context of healthcare and in some of the areas where you have tried to implement it? How have you tried to correct it?
What I often tell people is, AI is not itself is not biased. AI is not necessarily the problem. People have to create it. People use it. So I think there are two pieces, or maybe even three. There's definitely the data that goes in, right? Somebody's creating that, and if you're not choosing the right data, you don't have parity across different groups, different populations. If you're not being careful about what you're using and thinking beyond just what's in front, that can get dangerous. Obviously, then the how the model's created and which things we decide are predictive features, the decisions that get created out of that, that's certainly another aspect. And then it goes to how it's used, right? So there are also we have a responsibility when we go and use something. No model is 100% accurate, right? So if we think about we want to find all the in some cases where true positives are more important for us. In other cases, maybe true negatives are more important, right? It's more important for me maybe to not miss a cancer diagnosis versus ensuring that I have all the true positives in there. So I want to minimize, or the false negatives, I should say. I want to minimize those. So it is important to do that. And again, I think this is where we have to find some good ways to test for bias, potential fairness results that are coming out of these models that we're building. So as AI scientists, data scientists, analysts, we have that responsibility to make sure that we're either using tools or doing some just very basic, things like confusion matrix or matrices. Are we, if we compare men versus women in the results, are we getting the same sort of accuracy in our model? If we compare different races, is the same thing apply, and so on? That's a very basic way of looking at it. There are some solutions out there that I think the big tech companies are pushing more to say, hey, these will be Python modules or R packages or et cetera, that can help with some of these. But I think again, it's going to go back to that diligence and making sure that we're actually checking, we're actually trying to test and not making assumptions. And you'd be amazed how many vendors I've talked to who will say, oh, no, our model, our solution can't be biased. It can't do anything unfairly because we don't use demographics. And we have to take time to educate them as to why that's not true. And it's happened with some very large organizations, and it gets into some interesting debates. And that's largely because in my organization, of the governance process that we've got, that we challenge that. And those are, the bigger the vendor organization, the harder those conversations are, because they'll try to hide behind intellectual property and say, well, we can't share our bias and fairness tests with you if we do them, et cetera. But again, it's that, we have to force that conversation. We have to be very open about and honest with that dialogue.
Yeah, I think that's fair to say. And like you mentioned, right, no AI model is 100% accurate. And there are areas where, especially Especially my opinion about AI and healthcare, it's like a perfect example where technology can actually make an impact, right? There have been really excellent cases when, it has been used in conjunction with to human expertise, that it has improved healthcare in a lot of ways. Personally, I'm of the opinion that AI should be used in healthcare, right? It shouldn't, and it's again, like it's one of the perfect examples of how technology can enhance human life. But at the same time, right, there are certain areas where the risk, or the risk of AI giving a wrong answer is very, very high, right? It could be something like a detection where it's a false negative, right? A false negative diagnosis of through AI is something which is there. But at the same time, it also does go to say that the doctor needs to be kind of, there should be a human in the loop, right? Which is something that we talk about. Which are those areas in healthcare, especially, you believe that AI should not be implemented, if you believe that
I think in my opinion, I think it's probably too early to say where things shouldn't be implemented. I think, I would agree. I think that the potential for AI in healthcare is it's amazing, right? Anything from clinical care, in our organization, we're a rural healthcare system. So we've got disparities of care based on that. We have access challenges. There are a lot of opportunities to help not just improve access and improve the care that they're getting, but to try to drive costs down as best as we can. And some of those are operational. We've seen some uses in our organization. I've seen some in other, that peers have used, and colleagues in other healthcare systems that have helped drive some costs down. We've gained efficiencies. We've done things better. The experience has been better. So I think as an organization, it's important to have a risk management framework that, you have to decide what's your risk appetite when you're using AI. How do you want to classify these things? And when you classify something as low, moderate, high, or maybe there's just something you say, hey, we're not going to use this, right? Maybe as a healthcare organization, we say we're not going to use facial recognition. Now you have to decide what goes with that. What other requirements do you have? But it goes back to what you talked about. There, no matter what, at the end of the day, it's about accountability, and that has to be a key guiding principle for organizations, because someone still has to make a decision. A physician, a provider, they have to make that decision that yes, that is the diagnosis, or no, that's not the diagnosis, or this patient's has a high probability of getting readmitted to the hospital, or getting acquiring a chronic condition over the next 6 months, 12 months, et cetera. What do they do? I mean, that doesn't take away from the training that they've got. That doesn't take away from that human decision-making process. So it's a combination of things. But again, I don't, at this point, I think we just have to be careful. And governance can't be a way to say no. It's a way to, how do we just be careful? How do we create a little bit, maybe it's a little bit of a speed bump, just to make sure that we're not going too far too fast with this assumption that, hey, this AI is going to solve all of our problems. It's going to make everything better, because there are risks, and we just have to be aware of what those are and be prepared to mitigate those.
Okay, I think that makes, I think, that's a good perspective to have, that, AI governance should not limit the innovation, but at the same time, it should monitor it very closely, right? Which in a lot of ways summarizes your thought process when it comes to this. But then as we come to the end of the conversation, right? What is your vision for the future? How do you do it responsibly? What is your framework? You said every organization has a framework, or every kind of system should have a framework, whether to implement or not. How is your thought process around it? How do you see it evolving in the next 1 year, 5 year, 10 years? Responsibly, ethically, transparently,
I think recent updates to regulation, or upcoming regulation that comes around AI, is going to certainly help, right? So we've got the executive order from the White House now that says, we want to be able to look at how do we upskill staff, how do we bolster data privacy regulations for patients, or for anybody, for consumers. How do we make sure that we're using AI ethically, by mitigating bias and fairness issues, et cetera. So I think that's certainly going to help. That's not the solution everywhere. A lot of organizations, I don't think yet have AI governance, and it's not, to be honest, it's not a complicated thing to implement. It's actually, if you take a step back and you look at it, it's actually pretty simple. The hardest part about it is you have to get people to have the conversation and get comfortable with looking at everything, adding that to the process, requiring it where it's necessary, having a framework in place, and again, making sure that that's communicated internally. So I do think organizations, we're starting to see third-party solutions come out and offer sort of these platforms that will help with AI governance. And I guess I think there are some gaps that those can fill. It's not to say while AI governance is not a complicated thing, there's a lot of work that has to go into documentation and inventory and tracking decisions and so on. But technology is not going to be the solution. It really is going to come back to the people in the process, just like data governance. So we have to make sure that people understand, what those risks could be that you want to talk about. Be willing to have open and courageous conversations about things. And there will come a point where a request comes through that the governance, committee or council isn't comfortable, and they may deny it. And that will create some, that will have some ripples and create waves in the organization, because now someone's being told they can't do something, not because it's illegal, not because it's too expensive, but because that there are risks that the organization's not comfortable with. And it's what could happen, or, and so on. And again, those are tougher conversations, but there are, again, I would encourage organizations to look at opportunities, not to say no, but how do you, and this is how we look at it in my organization, how do we try to set things up so that we're saying yes? We want to make sure that we're managing risk as best as we can, that we're prepared. And then once something gets implemented, it's not done. You have to continually monitor and make sure that model drift doesn't create unintended consequences. There might actually be interviews or in-person observations on how something's being used or the impact it's having. So it's a very disciplined process. So I think we're going to start to see a lot more organizations. This is a really, really hot topic. I see it a lot in my social media feeds. I see it a lot in media now. And again, I think with the White House executive order, it's going to blow up even bigger. And I think it's a great thing. I think it's a really critical, in any industry, it's a critical aspect that we've got to look at. But again, with healthcare, we're dealing with people's lives. It's their health and well-being. It's their social, the social aspects that also can impact their care. It's really important that we're making sure that we're doing the right things for the right reasons.
Fantastic. I think one of the things that sticks to me is, and I really agree with you on that, technology shouldn't solve technology issues. There should be human beings in it, which is very important, right? On that note, Mitch, thank you so much for your time. I think this was a great conversation. It's an enabler for ecosystem, especially working at the intersection of technology and healthcare, to get a new perspective into what it should be, what AI governance should be. I think we went really well into detail, right? We defined the context, we went into detail, and your answers were very insightful and I'm sure very helpful in helping the ecosystem to build AI responsibly and ethically. Thank you so much.
Thank you. I appreciate you having me here. Thank you.